Hi, welcome.
Patrick Wilson here, looking to speak with Dr. Matthew. Is this Matthew?
Yep, this is Matthew. How's it going?
Good. How about yourself, Matthew?
I'm doing pretty well.
Great.
Thank you. So, what are you here to look at today?
I'm here to look into laser eye surgery and possibly see some of the benefits and what I need to look into and the bases that I need to cover before I move forward with any sort of surgery.
Well, I can tell you that we have come a long way in the past 10 years in developing laser eye surgery.
Okay.
As a company, we are very proud. We have set a very high standard in the laser eye surgery market, and we have mostly everyone that comes into our facilities comes out with good eyes. So,
Well, that's great. That's a good thing to hear.
I believe in what we do, and I think we can fix your eyes right up. So,
Great. Looking forward to it.
So we're gonna start. If you were a candidate for laser eye surgery, what we have to look at is your pupil size, the health of the eye, and what kind of stigmatism or nearsightedness or farsightedness you have.
So I would take a test to get all this done.
So yes,
before
this is
surgery.
the test is like a normal annual eye doctor checkup, just inspecting your eyes and looking at them to see if they are a candidate for laser eye surgery.
Okay.
So basically, that's what you need. That's what's gonna happen.
That's
you're gonna
the
have
preliminary
to go.
steps.
You're gonna have to go into an inspection for your eyes.
Okay. Great.
So I'm gonna tell you some of the cons because I have to do this as a doctor. I have to tell you all the risks that can happen.
Oh.
These do not happen often.
All right.
And I assure you that almost none of our clients have ever had any of these.
All right.
Okay, so the first risk I'm going to talk about is called the central corneal islands. This is small areas of raised tissue that show up after the surgery, and this can cause irritation to the eyes.
Mm-hmm.
It just pain from the eye. So it's not a huge risk.
Okay.
It can be. It just means that you have to come in for a checkup, and we prescribe you with some eye drops.
Okay. What are the chances of that happening?
The chances of that happening are about 1% of the people that have had this surgery.
All right.
So it's very low.
Okay.
Another risk is called the DIK. It's diffuse lamellar choroiditis. This happens when foreign bodies, dust, dirt, etc., become trapped in the cornea flap as the surgery is happening.
Ooh, so they almost get stuck behind the flap.
Yes, they get stuck behind the incision that we make in your eye. To do this.
That would be definitely irritating, most likely.
This has happened in the past because people didn't have the proper facility to do laser eye surgery.
They weren't sterile enough.
They weren't sterile, and so we basically have confined rooms where it's an airtight seal and basically no dust bigger than what would irritate your eye would go in your eyes in our facilities. So I can basically cancel out that risk.
All right, great.
This could cause pain and blurred vision and sensitivity to the light and an ongoing sensation that something is trapped in your eye.
Which wouldn't happen to me because it doesn't happen in your facility.
It does not happen in our facility.
Okay, good.
So there's one last very big risk that does not happen often.
All right.
It is, again, about 1% of the people that have gotten this operation. So this is called an epithelial ingrowth.
Well, 1% is fairly high, is it not?
This could not be fatal. It is not fatal. It would just mean you would have to get a corneal transplant, which is not the end of the world. Like, they're mostly successful, but this would has never happened to us, and I don't believe it will ever happen to us. It's just a lack of inexperience by the doctors, in my opinion, who people have gotten this.
But 1% has had this happen to them? 1% of patients?
Yes. Again, that is very low, very low.
That's pretty high. How many surgeries have you guys done?
We have done about 3,000 ourselves.
And you've never had anything?
We've never had any problems with that.
But you say 1% of patients get it?
In the studies that everyone has shown.
So 0% have got it at your facility?
At my facility, 0%.
Okay.
So we're going to move on, and basically epithelial growth in is when the corneal epithelium starts growing underneath the corneal flap.
All right.
Just it can affect your vision,
Mm-hmm.
and it can only be fixed by corneal transplant.
Okay.
So those are the risks. Again, I know
Alright.
they seem quite dangerous, but it's very, very low chances.
Okay. So what are some of
So
the
basically,
pros of what could happen out of
the
this?
pros,
I get to see.
you get to see. You're not going to have to use contact lenses or eyeglasses.
Okay.
This can help you stay relaxed.
Sure.
I have personally gotten it done to myself, and it has changed my life significantly.
So if I decide to go ahead with this procedure, how do you guys do it?
Well, the first thing we do is we make a circular flap on the surface of your cornea with an instrument called a microkeratome.
Okay.
Secondly, this flap is folded back, out of the way, and an excimer laser is used to remove tissue from the cornea. Now, the removing of the tissue from the cornea depends on your eyes and how your corneas look at something and how where the focal point is placed.
Okay.
So that is how it's going to work.
Okay, thanks.
What's because my hair was looking at me.
Okay, Matt, one more question before I leave you, Dr. Wilson. How much is it going to cost me to get my eyes with laser surgery?
Well, when everything is said and done, it will be about $2,000.
Okay.
A lot of people's insurance and benefits from the job will cover this. So
Okay.
I think you should come do it.
Okay, thanks.
All right, bye.